and her husband, Papaya Olate, are expecting their first child. Bianca could not go through preconception health care like many pregnant women here, something that could expose her unborn child to asphyxia. At the Kolebu Teaching Hospital, like other hospitals, few babies are born with asphyxia. They are often transferred to the neonatal intensive care unit for care.
I didn't go through any preconception care because I had no awareness about it. I eat a balanced diet, I listen to my doctors, everything they teach me here, I just follow it. That's all I do.
23-year-old Erica Mofa has a 4-month-old baby girl who is asphyxiated. Her baby was admitted to the intensive care unit for 2 months right after birth. She nearly lost her child.
4 days,
I hadn't set my eyes on my baby for 4 days. I only see her at the ICU when it is time to breastfeed.
Her baby is still recovering, but she still comes to the hospital often for checkups.
We come here every 2 months for her to be checked.
According to the Ghana Health Service, about 50,000 babies die from asphyxia in Ghana every year at birth. The Ghana Health Service says the figure could be higher, given that some of the cases that occur during home deliveries and outside recognized facilities may not have been captured in the data.
Birth asphyxia happens when a baby's brain and other organs do not get enough oxygen and nutrients before, during, or right after birth. It could happen before birth in the womb and result in stillbirths or during prolonged labor. According to the Newborn and Child Health of the Ghana Health Service, on the average, 1 million babies are born every year, and with the current neonatal mortality rate of 17 per 1,000 live births, it means for every 1 million births, about 117,000 are dying, and out of this, 30% are dying from birth asphyxia.
An obstetrician gynecologist at the Kolebu Teaching Hospital, Dr. Patrick Kenum, blames it on a lack of awareness of the condition.
It's a significant contribution to the number of babies we send to NICU. We are putting in a lot of effort to bring the numbers down. Okay. So before you get pregnant, you need to have what we call a preconception care. Okay. This is the care we will give to any woman who is planning on embarking on a pregnancy, because we know that your health status affects what happens to you when you are pregnant. So what we will say is that we are optimizing you for the pregnancy. Anybody with diabetes, anybody with hypertension, anybody with any chronic medical illness, you shouldn't embark on a pregnancy without having this preconception care.
He believes much can be done to tackle the issue.
The oxygen in the mother's blood must be able to enter the baby's blood. From there, the blood must pass through the baby's umbilical cord and go to the baby. So any place along this transportation system can cause the baby to be deprived of oxygen. Okay. For instance, for the mother to get oxygen, if you have a heart condition, if you have asthma, all these things will impair your ability to take in the oxygen into your blood. Okay. So you are not downloading enough oxygen, and the baby is going to suffer the consequence.
Having a dead or malformed baby in any society can be heartbreaking, but in Ghana, the stigma is particularly tough. Hence, the need to create awareness about birth asphyxia. Godwin Asidiba, TV3 News, Accra.